This video is proprietary to THERAKOS LLC and intended to be viewed in its full and current form. THERAKOS LLC does not permit viewers to use, reproduce, distribute, prepare derivative works, or display such video and content in any manner. THERAKOS LLC is not responsible for unauthorized use of this video and its content. The health status of the patient featured in this video reflects her opinions at the time the video was recorded. You're about to hear from a patient about her experience with skin symptoms of cutaneous T-cell lymphoma, CTCL, and treatment with the THERAKOS Photopheresis system and UVADEX, methoxylin sterile solution. This patient has been compensated by THERAKOS for their time in sharing their story. However, the views and opinions expressed by them are their own and do not necessarily reflect those of THERAKOS. Individual results may vary. Please talk to your doctor about your condition. What is UVADEX, methoxylin sterile solution? UVADEX, methoxylin sterile solution, is used with the THERAKOS Photopheresis system for the treatment of skin problems associated with CTCL in patients who have not responded to other types of treatment given by their doctor. Select important safety information. UVADEX, methoxylin sterile solution, should only be used by doctors who have special skills in the diagnosis and treatment of CTCL and who have received special training and have experience in the THERAKOS Photopheresis system. Do not use UVADEX if you are allergic to methoxylin, have a history of a light-sensitive condition or disease, have had an eye lens removed. Please carefully review and consider all the important safety information at the end of this video. For more information on the THERAKOS Photopheresis system, please speak to your doctor. Please click below for the full prescribing information, including the boxed warning for UVADEX.
For more than 10 years, I had rashes appear on my arms and chest. I saw several dermatologists and was told that it was just contact dermatitis. I switched to products for sensitive skin, but the rashes didn't stop. At first, the rashes were obnoxious and itchy, but didn't get in the way of daily life as a mail carrier, so I just dealt with them. Over time, they became more frequent and more uncomfortable. The rashes spread all the way down my legs, and I knew this wasn't just dermatitis. I went in for a dermatological appointment, and this time my doctor saw the severity of my symptoms and wanted to perform a biopsy. I remember sitting in my delivery truck when my dermatologist called with the results of my biopsy. She told me that my skin symptoms were from having cutaneous T-cell lymphoma, also known as CTCL. I was scared because I didn't know anything about cutaneous T-cell lymphoma. I knew the only way to conquer my fear of the unknown was to gain as much knowledge about my disease as I could. I talked to my doctor and started doing online research. The more I learned about CTCL, the less I felt that fear of the unknown. Even though I had started educating myself about CTCL, there were still many unknowns that kept me worried. What was the severity of my condition? What were my treatment options? By this time, I had a rash covering my entire body. I started topical chemotherapy, but my skin symptoms didn't respond to treatment. I decided to switch healthcare providers to a specialist that was more familiar with CTCL skin symptoms. Since the topical chemotherapy didn't work for me, my new oncologist suggested photopheresis as a treatment option using the THERAKOS Photopheresis system, which I like to refer to as THERAKOS or photopheresis. Immediately, I was thrown back into the world of unknowns. Once again, I turned to knowledge to combat my fears. I talked to my doctor about treatment and started doing my own research on THERAKOS. I learned that THERAKOS was an immunotherapy. Although the exact way THERAKOS Photopheresis works is not known, I thought it was a good idea to see if I could get my immune system to help with my treatment. My doctor and I talked about the risks and benefits, and I decided to give THERAKOS a try. I found a treatment center offering photopheresis close to my home and planned a visit to familiarize myself with the facility. On my first drive to the clinic, I was nervous. I didn't know how the process would go or what the outcome would be. It was still unknown and scary. When I arrived at the clinic, the nurses greeted me. They took me through a booklet about THERAKOS and showed me the parts of the machine and how the process worked. Seeing the equipment that would be used and the room that I would receive my treatment in made me feel less scared. The next time I went back was for my first 2-day THERAKOS appointment. Since I had visited the clinic previously, there was less of the unknowns surrounding that first treatment, and I didn't feel very scared. During my treatment, I was comfortable because of the level of support I was provided at the clinic. After that first visit to the clinic, I felt much less fear about the process. After a few months, my doctor and I started to see an improvement in my CTCL skin symptoms and continued my doctor-prescribed treatment plan. But this is just my experience. Everyone is different. My doctor said that I may be at greater risk of sun sensitivity with Uvadex, and that I should avoid exposure to sunlight during the 24 hours after treatment. My doctor also said that I must wear UVA light-absorbing wraparound sunglasses for the 24 hours after THERAKOS treatment, when I am exposed to direct or indirect sunlight, whether I'm outdoors or exposed through a window. I'm still able to work, but because of the fatigue I experience and my itchy skin, I currently work part-time. Since I started my treatment, my skin appearance is overall improved. It still fluctuates, and some days it looks more pronounced, but most days it's not too bad. Now, I want to be the patient that can help others feel comfortable as they begin treatment. I want to let them know that even for me, there are still things that can't be known. The fear is still there, but you can't let fear rule you. With knowledge comes power, and you can conquer that fear.
The following information is about the use of Uvadex, methoxylin sterile solution, with the THERAKOS Photopheresis system for the treatment of skin conditions associated with cutaneous T-cell lymphoma, CTCL. It is recommended that you discuss the therapy and your conditions with your doctor. What is Uvadex, methoxylin sterile solution? Uvadex, methoxylin sterile solution, is used with the THERAKOS Photopheresis system for the treatment of skin problems associated with CTCL in patients who have not responded to other types of treatment given by their doctor. Important safety information. Uvadex, methoxylin sterile solution, should only be used by doctors who have special skills in the diagnosis and treatment of CTCL and who have received special training and have experience in the THERAKOS Photopheresis system. Do not use Uvadex if you are allergic to methoxylin, any product similar or related to it, such as Sorolin, or any of the other ingredients in Uvadex. You have a history of a light-sensitive condition or disease. You have had an eye lens removed. Use of Uvadex in this condition can increase the risk of retinal damage. Warnings. You may be at greater risk of sun sensitivity with Uvadex. Tell your doctor if you are taking other medications that cause sensitivity to sunlight, such as anthralin, coal tar or coal tar derivatives, griseofulvin, phenothiazines, nalidixic acid, halogenated salicylanilides, bacteriostatic soaps, sulfonamides, tetracyclines, thiazides, and certain organic staining dyes, such as methylene blue, toluidine blue, rose bengal, and methyl orange. If you're pregnant or plan to become pregnant, tell your doctor. Methoxylin can harm your unborn baby. Tell your doctor right away if you become pregnant during your Uvadex treatment. If you're breastfeeding or plan to breastfeed, tell your doctor. It is not known if methoxylin passes into your breast milk. After Uvadex is given, exposure to sunlight and/or ultraviolet radiation may result in premature aging of your skin. Let your doctor know if you currently have skin cancer or if you've had skin cancer in the past. If you're given too much Uvadex, you may get serious burns from UVA or sunlight, even through window glass. Avoid exposure to sunlight during the 24 hours after treatment. Exposure to UVA light when Uvadex is used can cause cataract formation if proper eye protection is not used. You must wear UVA light-absorbing wraparound sunglasses for the 24 hours after treatment with Uvadex when you're exposed to direct or indirect sunlight, whether you are outdoors or exposed through a window. If you're being treated for graft versus host disease, GVHD, consult your physician for information regarding blood clots involving the lung and other parts of the body, which have been reported in these patients. The use of Uvadex for the treatment of GVHD is not approved by the FDA. Safety of Uvadex in children has not been shown. Side effects of Uvidex. Side effects of Uvidex used with THERAKOS Photopheresis system are mainly related to low blood pressure. For the THERAKOS Photopheresis system procedure. What is the THERAKOS Photopheresis system procedure? The THERAKOS Photopheresis system procedure is a medical procedure in which blood from a patient is collected into a specialized machine that separates the white blood cells from the other blood components. The other blood components are returned to the patient, and white blood cells are then treated with Uvidex, which makes them sensitive to ultraviolet light. The treated white blood cells are exposed to UVA irradiation inside the machine and then returned to the patient. This medical procedure is used to treat skin problems associated with CTCL in patients who have not been responsive to other forms of treatment given by their doctor. Do not undergo the THERAKOS Photopheresis system procedure if you have a condition that makes you unable to tolerate loss of blood volume, you are allergic or hypersensitive to 8-methoxysorolin, methoxylin, or sorolin compounds. Your doctor has diagnosed you with a blood clotting or bleeding problem that can lead to either a blood clot or excessive bleeding. You have had your spleen removed. Warnings for the THERAKOS Photopheresis system procedure. Treatments with THERAKOS Photopheresis system should always be performed where standard medical emergency equipment is available. THERAKOS Photopheresis system procedure should not be performed on the same day as procedures that can cause fluid changes, such as renal dialysis. Side effects of the THERAKOS Photopheresis system procedure. Low blood pressure can occur with the THERAKOS Photopheresis system procedure. You may get an infection and/or feel pain at the site of injection. Fevers of 100 to 102 degrees Fahrenheit, 37.7 to 38.9 degrees Celsius, have been seen in some patients within 6 to 8 hours after treatment. Redness of the skin may also occur with the fever. A decrease in red blood cells can occur if the THERAKOS Photopheresis system procedure is given too frequently. Low levels of red blood cells may cause you to feel tired. These are not all of the possible side effects of the THERAKOS Photopheresis system procedure. Tell your doctor about any side effects that bother you or that do not go away. Call your doctor or pharmacist for medical advice about side effects. You may report side effects to the FDA. Call 1-800-FDA-1088 or visit www.fda.gov/medwatch. You may also report side effects by calling THERAKOS LLC at 1-833-223-4ECP, 1-833-223-4327. Please see the full prescribing information, including the boxed warning for Uvidex, at www.therakos.com.